Diamond, and I am the founder and the director of the Diamond Method, active myofascial therapy and active muscle massage. So today we're going to show you addressing the pecs and the forward head posture that Mark has graciously demonstrated for us, unknowingly, but obviously he presents with that forward head posture just as many of your clients and patients do. So we're going to be doing a technique to the front of the chest, the pecs, and this is actually both active myofascial therapy as well as active muscle massage, so it's in both of them. So it addresses the tightness that your client has with the front internal rotation of the shoulder and all of the areas of the chest. So what I'm going to do is use just a little bit of lotion. Again, what we're doing is myofascial work. We're not using too much. We don't want to be sliding over the tissue. We want to be getting in and hooking into the deep tissue of the muscles and the fascia. So with the pecs, and if you have a male client with lots of chest hair, you want to make sure you're using enough lotion, not too much, but that you're not going to be pulling the hair. So what I'm going to have him do, I'm going to be working on his right side, and so I've already placed his hand on his belly, and this is where you want to have your clients put their hand. What that does is that gives him an anchor point. I'm going to have him move his shoulder, so he's going to bring his shoulder towards his ear. So go ahead and demonstrate that movement, Mark. Bring your shoulder to your ear. His arm just slides along the table, and now bring your shoulder down towards your feet. So that's the active. Remember, active myofascial therapy, the client is active. They're doing part of it. Go ahead and relax. They're doing the movement, you're applying the pressure, and they're making the movement happen that you would naturally do with your thumb or your finger or your forearm. This is making it so much easier for you as a therapist. The client's in control. They love the ability for them. They're driving. They're in the driver's seat, so they can control it. It's less scary for them. It's much more comfortable because they can control the pressure. They can control the amount of comfort or discomfort that they feel. And at any point, they can always stop. So it gives them a complete sense of control, which makes it easier for you. So getting into the pecs, you turn their head to the opposite side. So if I'm working his right side, he's going to turn his head to the left. That just gets it out of the way so you don't bang into him. And you're going to be using your forearm again. So there's 3 passes that you're going to do for the basic technique for the pecs. You're going to make one pass that goes down, starting right in the meaty pocket here. Obviously, you're aware of the nerves and the arteries that are coming out. You're going to make a pass. If this is a female client, you're going to have her draped, and you're going to go just to the point where you feel comfortable. Again, just in basic massage, you know how far you're supposed to go. That's where you end with active myofascial therapy as well. So one pass there, one pass here, go along the clavicle and right along the sternum, one pass down here. Obviously, you're lightening up over the bony tissue or the tissue that's over the bones, and you can go in deeper where it's more of the muscle and the meat of the work that you're going to be doing. So again, I've directed him on what he's going to do. His hand stays right on his belly. I can use my other hand for support here if I want. And then Mark, as I go in, you're going to tell me if I need to lighten up, obviously. Bring your shoulder towards your ear. Hand stays there. Slide it all the way up. And I'm just holding. I'm just pinning and stretching. I'm holding it. He's moving. And now press that shoulder down towards your feet. Slide your shoulder down to your feet, and then I follow it down a little bit further. Again, going right to the edge. And then I can slide off a little bit. Perfect. Relax that. You okay? Mm-hmm. Good. I'm going to move a little bit more medial. I get right in. I'm not on the clavicle, right? So I'm just along the attachment points. Sink right in. Slide your shoulder to your ear. Perfect. Slide it down to your feet. And I follow it down. I press up on my back toes so I can get a little bit more push. Excellent. And release. And then I'm going to go in my third pass, sink right in there, right along the clavicular sternum attachment, and slide your shoulder again. Yep. And then slide down to your feet, and I just follow it down. Perfect. And relax. Good. And then we talked about pulling the taffy. So then I get in there and I just stretch the tissue as far as I can. Again, if I was doing active myofascial therapy, I would probably be using less glide, and with active muscle massage I can, because again, they're coming in more for relaxation purposes. If you want, you can also use the base of your hand. You can also use a fist, keeping your wrist neutral. So same concept here, straight line all the way up, shoulders down, No stress on me. Bring your shoulder to your ear. Good. And bring your shoulder down to your feet. So you're going to need to choose the best tool, whether you want your forearm to do it or your fist. Go ahead and do that again. And down to your feet. And after you've worked with the client, they know the movements. So you need to, I'll give you a warning. Sometimes they start moving before you're ready, so make sure that they know that they have to wait for your call. Okay, and go ahead again. Slide it up to your ear. Good. And down to your feet. Perfect. Now, this is pretty intense work in here, so obviously they're going to be giving you feedback along the way. Finishing with active myofascial therapy, you always want to have them take that arm through full range of motion. You can give them a stretch if you need or if they want. You can give them resistance. Eccentric contraction is the most effective for this. So go ahead and press up with this part of your arm, press up towards the ceiling. So he's contracting the movement. This is contraction, concentric contraction, and now he's going to resist me. So you press up as I press down towards the floor. Let your elbow come down slowly. There you go. That's the eccentric contraction, and that's the most effective in taking the fibers that you just loosened up and lengthening and elongating. So there you go. That was active muscle massage and active myofascial therapy for the pecs in a supine position. And then you can have them straighten out their neck and obviously work to the other side if you want. So again, I'm Irene Diamond, active myofascial therapy, active muscle massage, thediamondmethod.com. You can also like us on Facebook, which is facebook.com/therapy success. Thanks so much, and we'll see you in one of my seminars.